Hello, I'm Professor Susanna Banerjee. I'm a consultant medical oncologist at the Royal Marsden NHS Foundation Trust and a professor in women's cancers at the Institute of Cancer Research in London, UK. Welcome to our fifth episode in our podcast series titled Beyond Primary Treatment. How else can we benefit our patients through a holistic approach to care? Joining me today is Serena Scrudato, who is a study nurse at the National Cancer Institute of Milan, Italy. Welcome, Serena.
Thank you very much for the invitation.
I'm very much looking forward to our podcast, as this is such a broad topic. And perhaps we can kick off by me asking what the role of a study nurse is and beyond in Italy.
So I can speak from my experience as a study nurse in Italy. Here we follow patients in terms of the assessment, including after the end of the study. We are the main contact in terms of safety reporting by patients. We are also the main contact person for patients here in the hospital. We help with managing their adverse event and throughout the patient journey. What about your institution, Susanna? What is the role of the nurse there?
So the role of the nurse in the UK is a very diverse role, as I'm sure it is in many countries and institutions. There are many roles, and it's a variety, and importantly, the role continues to evolve in order to support our cancer patients. So if I can first describe the role of a term we call clinical nurse specialist, this is a vital role for people with cancer. The role of the clinical nurse specialist is to act as a key worker across the whole cancer pathway. So that will include supporting, explaining treatment plans, listening to people's needs, supporting them through navigating the services when a patient is diagnosed and on treatment, and also patients' preferences. Part of that is also addressing the health concerns of patients and really working together to promote health and well-being in cancer patients, and most importantly, being the patient's advocate. So in terms of a study nurse, as you've explained, it is the above role, but then specific to research and trial-related treatment and activities and practicing with good clinical practice in terms of research activities. We also have a role for a nurse called an advanced nurse practitioner, and this has really revolutionized the clinical delivery of care for our cancer patients, and this role is evolving. So advanced nurse practitioners, or ANPs, work alongside the doctors, assessing patients on cancer treatments, for example, to see if they can go ahead with their next cycle, so assessing side effects, assessing whether a dose modification is needed, prescribing treatment, not only cancer treatment, for example, immunotherapy, but also supportive care treatment, for example, treatment to manage diarrhea or blood transfusions, and also being on the front line managing the acute oncology complications. And the key point here is working as a team with the patient at the forefront to support patients through their care. And what's really important, I'd like to ask your view, is given the evolving roles of a multidisciplinary team supporting cancer patients, it's really important to discuss communication. Communication not only directly with our patients, but also within the team between the oncologist and nurse and also with the patient. So I'd love to have your views on patient communication and the circle of communication between patients and the cancer team supporting the patients. So Serena, perhaps you could mention a bit about patient counselling at this point.
Toxicity management requires interaction between the oncologist and the nurse. We inform patients that side effects may occur at any time, even after discontinuation of therapy, and they should be educated to report symptoms without delay to enable timely management of toxicity. This is because decisions are taken as part of team, although the medical oncologist has oversight over treatment decisions such as the dose management.
Great. So I completely agree with you that the management of side effects is a key and important part of communication with patients, as safety is paramount. So keeping patients on treatment safely at the correct dose, supporting with dose delays or perhaps reductions, depending on the side effect profile. And it's very individualized for each patient. And so it's really key that not only discussions, but listening to patients is really important. And sometimes it's the relationship between an individual healthcare worker and the patient. I do see in practice, in my practice, some patients may report some toxicities, for example, to the nurses more so than to the doctors. And it's about individual relationships with the patient and also making sure the patients feel secure and in an environment where they can speak freely about their experiences on treatment, so that we as a team, the nurses and the oncologists, can modify the treatment based on the experience, which includes side effects. And I'd like to touch upon what you mentioned, that side effects can be acute or immediate whilst actually taking the drug treatment, but it can also occur not immediately on treatment, but later, whilst a patient may have had several cycles of treatment. And also after stopping treatment, for example, with immunotherapy, there may be some side effects that are late onset. And so it's really important that we gather all the information about how our patients are feeling throughout the patient's pathway and journey on treatment and off treatment. What do you think, Serena, is one of the key side effects that you see in practice? Could you mention one of the side effects that you think we can help support patients with?
Nausea, vomiting, diarrhea, rash, nephritis, and vomiting. That's the most common.
So I think with side effects, what we term low grade or mild side effects, if they're continuous, can really have an impact on our patients. So as well as the more serious side effects, like, for example, colitis or pneumonitis, which can be very serious and potentially life-threatening, fatigue is an important side effect that we need to investigate, which could be related to anemia, for example. So checking for B12, iron levels, folate, and with some of the immunotherapy agents, we know that it can affect the thyroid, which can also lead to fatigue. And so I would also add that the point that so-called mild side effects can really impact on the quality of life of our patients. And to maximize patients continuing on treatment, they need to be investigated and with supportive medications as treatment so that the side effect profiles are managed as best as possible for as long as possible. So moving on to outside of management of side effects, Serena, what else can we do to support our patients with endometrial cancer?
We should be helping our patients with returning to work and with how they can manage their children, as many of patients have children at home. Although we are not directly involved, we are at least monitoring the situation with the quality of life questionnaires. These questionnaires are holistic in nature. On one hand, they assess physical symptoms such as nausea, vomiting, asthenia, or the appearance of rash. However, we are also inquiring if they have difficulties with coming the treatment center, if they have difficulties with work, difficulties with their family life. And finally, we are also assessing if treatment is actually a cause for these difficulties and if this causing them financial problems.
Thank you, Serena. You really highlight the important points that our patients face going through therapy. And quality of life can be a broad term and mean so much to different patients and different aspects of quality of life. I think we need to have better tools for assessing quality of life and to assess quality of life continuously, not just at the start of treatment, but during treatment, and thinking ahead of the immediate, the acute impact on quality of life, but also in the long term, when patients may not only continue treatment, but after treatment, like you mentioned, returning to a new normal life, returning to work, being a woman rather than seen as solely patient with cancer. So I think the quality of life is a really important aspect, and we need to integrate that more. We can always do better in our clinical practice, but also focus in clinical trials on quality of life. Are there any other aspects, for example, in your practice in follow-up that you are implementing to help support patients, Serena?
Yes, we use a mobile phone application which can be employed for follow-up of cancer treatment. This application is direct contact with us for anything the patient might need after completion of treatment. This means that although they are not coming into the center, they are always in contact with us. I should note that this application doesn't monitor their activity. There are apps which monitor BPM or their movement. The application that we are using is for the patients to be in the direct contact with us. Application which monitor activity can also be used if the patient doesn't move for a long time. The app will let us know, and we contact the patient to see if they have any issues that we can help with.
That's very interesting to hear, and I'm sure that these developments of apps with the aim of supporting patients will increase, and our experience will increase, across different cancer centres and different countries. It's really important, as you describe, about patient education. So patient education about the cancer itself, what the treatments can achieve, what the aim of treatment is, I think is really important, as well as what the potential detrimental effects, so side effects and the impact on quality of life can be described. And some of these treatments, as patients feel better, can of course improve the quality of life. I feel that patient education materials are essential, and it's essential for the materials to be clear and in a language that patients can relate to. And any other support measures given to patients, like you mentioned, new tools being used and developed for clinics such as patient apps. So thank you, Serena.
Thank you, Susanna.
And thank you to the audience for participating in this activity. Please continue on to answer the questions that follow, and don't forget to complete the evaluation.